Here we are with our patient in the preoperative arena, and this patient's come to us for a genioplasty and jaw sculpting and an angle osteoplasty. His main concerns are that he's desirous of augmented chin both in the vertical and the horizontal dimension, and he's very particular about the dimensions himself, so about 10 mm in the vertical plane and 14 to 16 mm in the horizontal plane, and that's the maximum actually we can do for him. But in the end, it's after fixation of one of the plates, we usually check that it is proportional to the upper and middle third of the face. So don't worry about the dimension. We will actually check and measure to let you know. If we feel it is too much or too less, so it might just vary off a few mm, but otherwise it's as planned. Other than that, we plan to do a bit of angle osteoplasty. So the flared angles that you see on either sides are going to be reduced. So all the work is going to be done inside the mouth. It's an intraoral procedure. It would take us over 2 hours max. And the stitches we are going to put inside are going to be resorbable ones, so you don't have to take it out. Yeah, you'll be good to go in maybe 5 to 6 days. You can go back home. The only thing is you have to be on a liquid diet for quite some time. On the 5th day, maybe start soft diet. That's it. Right, so this is day 8 following a genioplasty and an angle osteoplasty. It's going to be a bit painful because of all the hair that has grown. But slowly.
Bit is on with by the way.
Thoda sa. You want to? All right. So he just said he's out of help because I took out the Dynaplast, the compression bandage which was placed. So he's come to us with a very broad chin and a broad angle. That was his major complaint when he came to us. And you did have a broad chin to start with, although you had a recessed chin, correct? But the width was quite, like when you compare it to your lip, it was almost the size of that. So now what we have done is, if you see the frontal view, you can have a look at it in the mirror. Yeah. So we've done both vertical and horizontal augmentation, brought the chin forward as well as down, and this curve that you see here, that's what we've given you. If you see the pre-op, it's very broad right here. Whereas if you see now, we have not done anything to the breadth, but given a shape. We've done jaw sculpting along with the genioplasty so that it is in alignment with your lower jaw, with this inferior border of mandible. Apart from that, as you desired an angle osteoplasty, so right at the angle, you won't be able to appreciate it clinically as of now because it's too early in terms of swelling, but on the scan, you'll be able to see the difference. So it is both a genioplasty with jaw sculpting and an angle osteoplasty, and the entire procedure is done intraorally. So all his sutures are resorbable. He does not need to take them off, although they will take about 30 to 45 days to resorb on their own. But overall, yeah, can you look at your side? Yeah. All right. So here you can appreciate the augmentation, especially in the horizontal and the vertical dimension. We're going to clean all this off. We'll actually take you for a scan now, and I'll be able to explain better on the scan in terms of how much augmentation, how much osteoplasty has been done on both sides.
Exactly what's planned, we have done. So this is the right side. So we have not taken it back. I told you will do only this straight line and the chin. I'll show you the measurement later on in a
I
while.
would have preferred if you had done some back work.
But you told me not to do on that side. This side I have done. Can you see the difference?
This side back work has also been done.
Yeah, left side. Because left side is a bigger swelling. So full cut and made a proper shape, and this is a straight line. Now the amount of advancement.
It's not. Is there a asymmetry a little bit on left side?
Should not be there.
Scans don't show it, but
Scans are not showing. So we have to wait for it. 99% nothing will be there. When you're doing huge advancement, sometimes it can move a little bit, but let me check if it has moved. You can see the screws are all fine. Everything is fine only. Nothing will happen. I've put an extra bone in between also.
You added an extra bone in between?
Yeah. We removed the bone from here and put that bone in between.
Wonderful. That's what I asked for, bone, some resorption.
Yeah, we've put there.
Can I get photos of this?
CD is only there with you.
Okay. 10 mm vertical.
Little less, it's showing 9.8. I did 10, but that's because curve, some of the times it will be like little more or less. It's more than 16 mm horizontally.
That's awesome.
You can take a photo of that if you want. You can see the improvement. So generally more than 14 mm I don't do because we need to put bone grafting. But fortunately in your case, because we got the bone from your left side, which was like excess, so I used that to put it in between that's why you can see this piece of bone inside. Okay, that was done because you will have more stability and you desired as much advancement as possible. But that piece is not fixed. That bone piece is literally loose. It should not move, but you have to be careful. That's
As
all.
in?
I think just careful as in don't let any infection happen there, or normal precautions, whatever we tell you to follow. This is for you. Keep one before, one after. Show me his first photos. Let me have a look on the pre-op pictures also. Yeah, that's a huge improvement. And your result will take time. It's going to get even better. This is huge already.
When I see it?
Yeah, you can see how you looked.
Wonderful. This was possibly a worse picture.
No, the improvement is very, very good. And you see, you come to the mirror, I'll show you something very dramatic in your case. See like that in the mirror. See here, the angle is from down to up. Now you see.
Yes.
This is like one of the extremes you can get. When the angle is going from opposite direction, and now we're making it down like that. So that's because of the work that we've done here, and I told you the work we did at the ramus angle, and also there. This length has increased so much. This was short, had a double chin, that has disappeared. And this will all disappear more. This is like just 1 week over now. By the time you are like 2 weeks and all that, it's going to be incredible changes. And this side also. This side, it's not like a reverse angle becoming a positive angle. Because remember, you had asymmetry that was more on the left side. So anyway, I think the result is very good, and you have to take enough care of yourself. So give it 4 weeks minimum for bone to heal. 6 weeks it can take. What I recommend is We give you a lotion or an ointment, you put it inside the mouth. No physical activity, strenuous activity. Don't sleep on the sides. Don't let any kids sit on your laps.
Sleep at sides, there is little blood coming in.
Yeah, it can happen because the work is happening under the muscle also. So no sleeping on the sides for maybe 1 more week. You can start eating semi-solid food from a day or two, but don't chew, swallow. You can brush carefully without injuring anything. Stitches are all dissolvable.
After how many weeks?
5 weeks, sometimes 4 weeks, sometimes 6 weeks. It takes a while. And that's it. If you can contact us on our follow-up numbers. It might take a few months before you get your final result, but it's only going to get better and better and better because the swelling is going to keep getting less everywhere, and then the shape will get even more better with the
Facial repair.
yeah.
I have 2 questions. Can I ask?
Sure.
After how many months of this surgery, genio and angle osteoplasty, can I get fillers and botox? A little bit of might be needed. So just
9
to
months.
shave. 9 months.
Yeah. Don't do anything before that. No filler botox till 9 months. Because the end result might take that long.
Gym after 1 month.
2 months.
2 months.
No, in your case, little more than 1 month. 2 months better. Done? So,
My lower lip is still like 2.5x, 3x in size. How is that?
it'll reduce. It will reduce. It takes a while for the muscle to shrink. It doesn't happen immediately. It will reduce. Give it some time. See after 6 months. Take before after
Last
photos.
question. Assuming in future I want to get a little bit of shaving done on both sides.
One more time.
No. We have done the lower part of it.
Yeah.
The asymmetric part of it. But the back part of it we have not done.
It looked good only. You wanted it, right?
No, we have not done that. No.
But you wanted that. You didn't want me to shave. You said you
I
liked the way.
wanted you to shave. There is a miscommunication and all that.
No, you said only this side you want because of the asymmetry. This side I like the back. I only want the lower. Don't do anything now. It's fine. It'll be very good.
If in case in future I want
These are all major surgeries, you know. You should not. How do I say? I don't know why. When
get
you
them
do-
done.
Yeah, it's not a casual
I
thing.
understand, but after 1 year or so, if I
Why you will do after 1 year? Unnecessarily. It'll be very nice. See, life is not just one. When you came, there was a big issue. We've improved it. I don't think you should think of another surgery when you're not even recovered from a surgery.
No. After 1 year, I'm asking for. अगर मुझे 1 साल बाद लगता है कि थोड़ा सा करवाना है 3-4 mm पीछे से
बस 3 mm के लिए आपको इतना वापस मेजर सर्जरी करना पड़ेगा. सोचो ये उचित है नहीं है.
yes just in case
It's an option. कर सकते हैं. Technically possible, but common sense wise not a good idea.
okay last question should I get a rhinoplasty
That is up to you. No, how can I say whether you should get a rhinoplasty or no? See, nose is something everybody's nose or most noses I can improve. Very few noses we cannot improve. If that is causing any big issue or something, you can get it done. Otherwise, don't do it. I'm not going
लगता
to.
है कुछ significant improvement
Improvement हो पाएगा. Significant जितना कि इसमें किया इतना नहीं होगा. Minor, subtle, less improvement possible. Because basic nose shape is pretty good for you. It's not like bend है ये वो है वो. थोड़ा grooving है. And that's all. Apart from that, it's fine. So don't hurry up. Huh?
so doable
Of course, doable. Yeah, we do all kinds of crazy noses, so it's doable. Of course, doable.
visit you in a year
We'll see. Yeah, if you come over, then you're more than welcome to come. And then if you want something, we can do. All right.
thank you doctor
Take care. Bye.
it was a life changing experience
Thanks, man. I appreciate it.